January 2013, 26 researchers, monitoring and evaluation experts, and program specialists working in the area of social and behavior change and public health in Africa gathered in Addis Ababa, Ethiopia to contribute to the evidence review on social and behavior change for child survival in Africa. At this meeting, the experts reviewed African research findings on various types of social and behavior change interventions, including interpersonal, community-based, mass media, and technology-based approaches. And they shared evaluation findings from their own countries in order to examine evidence on what works.
And the results as you can see.
The group also reviewed research on broader cross-cutting issues such as gender and inequities, system approaches, effective partnerships, and delivering social and behavior change at scale. In the final technical session, participants discussed strategies for ensuring more focused, rigorous, and coordinated research. The main purpose of the African Evidence Review has been to provide new evidence to enhance the finding of the Africa-focused literature review being prepared by Johns Hopkins University, and to provide recommendations to feed into an international review of evidence supported by USAID and UNICEF to culminate in a global evidence-to-action summit. In Ethiopia, the Social and Behavior Change Evidence Review meeting had a unique additional advocacy objective and was strategically timed to coincide with the high-level meeting of the Ministries of Health held at the African Union from 16th to 18th of January. This high-level meeting, hosted by the Ethiopian Ministry of Health, is part of Ethiopia's pledge to assist in the Call to Action, a global initiative to renew the commitment of political leaders to the achievement of the Millennium Development Goals by 2015, and specifically the goals of child survival.
It was back in June of 2012 that the government of Ethiopia accepted to co-host the Washington Summit of a call to action for child survival, a promise kept, with the government of India, the United States, and UNICEF. The main objective of the summit was to propose to the leaders of all countries of the world a renewal of their commitment to child survival and to the elimination of all preventable diseases within 2 decades. What's impressive in our continent of Africa is 47 out of 54 countries signed the call to action pledge and with determination to achieve 100% of the targeted goals. I therefore call upon all countries to honor your pledge with a firm local commitment, national plans and budgets, but most importantly, with action.
We seem to all agree around the importance of community-based approaches, and I think the presentations highlighted the need not just for skills, but also appropriate behavioral practices. And in many instances, this require addressing harmful socio-cultural practices. Now, despite this, I think there's very little resourcing that has gone into behavior change communication programs. And this despite the evidence that shows that there's a lot of successes that can be made if we try and focus on behavior change.
Our biggest challenge, and it still remains, I think, in Africa and in South Asia, a baby is not named because we expect they won't die. They're not considered a human being. How can we change norms where we're going to say women never die giving life and that babies shouldn't die, even if they're small, if we don't deal with that? So I think this is absolutely critical. And what we see is often the behavior change where we see good, effective behavior change often isn't scaled. So I think that's what's particularly exciting about this.
Yes, there's been a concurrent meeting which started before this meeting on behavior change, looking and reviewing the evidence and bringing together the evidence across Africa more specifically. And I don't know if anybody from that meeting would want to just give a quick summary.
This initiative is really first to get the hard evidence that we have. And we have colleagues from the Johns Hopkins University working with both UNICEF and USAID to capture this evidence. But another part of it is to gather the tacit knowledge of persons working in the field. A big issue we have been looking at in this two-day meeting is the lack of coordination within ministries of health for the function of social and behavior change strategic management. We can't do this more effectively unless we have plans that are resourced. And this needs real serious thinking about the leadership for social and behavior change within ministries of health as part of the health system.
We're absolutely thrilled to see, even in the first morning of this meeting, that people want to know what's coming out from the evidence-based summit going on in behavior change, and that we're really beginning to understand what it's going to take to actualize and make sure that behavior change is part and parcel of national plans.
During a special panel organized as part of the ministerial meeting, experts from the pre-meeting presented case studies of successful social and behavior change interventions throughout the region and outlined policy and programmatic implications for consideration in country efforts to improve maternal, newborn, and child health.
The National Plan of Action that the Ministry of Health has more than building capacity of health workers in doing case management. We need people, technical people at the national level, at the ministry level, who have the expertise in understanding behavior and communication. Nothing will happen if you don't have the investment. If it is a specific priority activity within the government plan, it will be budgeted for, human resources can be put in place, and that can help into translating into specific actions.
The primary goal of the call to action, Promise Renewed, is to mobilize African governments, ministries of health, and the global development community to accelerate evidence-based actions to scale up high-impact interventions that will further reduce child mortality rates to 20 or fewer per 1,000 live births by 2035. Now, social and behavior change has been recognized as an important pillar in achieving this goal.
What's very exciting about this initiative on child survival leadership for action is the fact that for the first time we really see that social and behavioral change is being fully integrated into the mainstream agenda of this meeting on reducing under 5 mortality, not just to the MDG goals, but to 20 per 1,000 live births. And we really see a very strong call from all the ministries of health around Africa and their delegations for more efforts being made to document what's working, why it's working, and scale it up and replicate it in other countries.
In their concluding statements during the closing of the African Leadership for Child Survival, a Promise Renewed meeting, MNCH program managers and ministers of health from across Africa committed to including social and behavior change as a new area of strategic focus in their accelerated plans to address child survival.
It was also important to look at the behavior and communication strategies. It is important that there is integration, and to achieve this integration, there must be a communication plan so that all stakeholders are very clear of the plan so that it can be implemented properly.
And it was also very important that we incorporate social and behavioral change strategies and mainstream them within all the other all the interventions that we identified.
Et sur cette base, donc, nous avons retenu qu'il faut élaborer une feuille de route par rapport à l'OMD 4 ou bien un plan d'action opérationnel qui intégrera bien sûr une stratégie spécifique pour les changements sociaux et comportementaux.
Ici, nous comptons travailler avec les agents communautaires de prestations et les agents communautaires de changement de comportement, ainsi que tout le personnel pour que nous puissions inverser la tendance.
Social and behavior change should be considered as one of the high-impact interventions, because most of the interventions that would help children to celebrate their 5th birthday are implemented by adopting healthy behavior and by communicating these healthy behaviors at scale. So social and behavior change should be adopted by every country, and it should be done in a way that would disseminate and aim to bring about behavioral change for adopting critical MNCH interventions.
While the focus on evidence and evidence gathering on social and behavior change in Africa gathers momentum, the evidence to action process for child survival has already begun.